from the American Academy of Pediatrics.
Most of us realize noise is bad for our hearing and our health. But when it comes to our kids, exactly how much noise is harmful? And if you live in a loud part of the world, like I do, what can you even do about it?
I think that we are kind of in a new age of awareness about noise, and I want parents to think about noise a lot like the way we think about protecting our skin when we're out in the sun.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today we're talking about noise, a topic that is top of mind for me here in New York City. And because of the timing of this episode, right before the 4th of July fireworks, it may be top of mind for many of you at home, no matter where you are. Today we have Dr. Brian Reilly. He is a pediatric otolaryngologist, aka an ear, nose, and throat doctor, and co-director of the cochlear implant team at Children's National in Washington, D.C. Brian, welcome.
Thank you, Edith, for having me. It's a real pleasure.
No, I have so been looking forward to this conversation, and I wanted to start, as we often do on this show, with a little bit of context. As I mentioned, I think many of us know that noise is not good for our hearing and for our health, but when it comes to children specifically, what are the concerns, Brian?
Great question, Edith. I think when you look at noise, it's all around us, it's everywhere, but there are things we can do to try to mitigate this and keep our ears healthy, preserve our hearing for as long as possible. There's kind of three main categories of noise. The first one is occupational, and there's been OSHA, which is helped try to minimize the amount of noise that's in the work environment. Hospital settings, NICUs can be incredibly noisy environments, but we really work hard to minimize the alarms that go off for babies, but they have to, of course, be in incubators. So occupational noise is a big one. The second thing is environmental noise, which is we're immersed in all of this sound, and the sound can sometimes be overwhelming. It can be sound from the traffic on the street, to the construction that's happening in the high-rise next door to you, to the leaf blowers and the lawnmowers in suburbia. That is a big deal, and you have to be aware of that because, you can close the window or you can move away from that loud noise stimulus. And then there's recreational noise. We enjoy our listening devices, listening to music, going to concerts, sporting events. And in those arenas, a lot of times, unbeknownst to a lot of parents, those noise decibel levels are dangerously high. And just a few hours of exposure going to Madison Square Garden or to a concert venue can sometimes have longer lasting effects. And all of this noise, which seems like it might be harmless, instead can be creating a reverberation within the inner ear system that essentially causes these small, fragile little hair cells to wear and tear and sort of die, essentially. So we have to be really careful because kids are a vulnerable population.
Yeah.
They're vulnerable from the young age, and they're vulnerable through adolescence, and that can have a cumulative wear and tear.
Yeah, and that cumulative piece is always so interesting to me, right? It's over time, a potential harm. So you started to mention some of the triggers, some of the offenders, I guess we could call them, right? You talked about cell phones, you talked about concerts. What else, Brian, as we go about our day-to-day lives, should we be mindful of as potentially harmful sources of noise for our kids?
100%. Well, I think one thing that's really been kind of in the news more recently are these white noise machines. So we got to be most careful about our vulnerable infants, our babies. And these white noise machines can sometimes think for parents, this is helping my child sleep through the night. But instead, they can emit sound levels that are above the 85 decibel level that's considered to be safe through OSHA standards. And what it does is it basically, if it's too loud and it's too close to the baby, it can cause potentially hearing loss. So the American Academy of Pediatrics, which helped sponsor this and help with the clinical report that we worked so hard on, recommends that it's kept at the softest, lowest possible setting and as far away as possible from the infant. So that's one vulnerable population. On the other side, you have teenagers who like to sometimes, enjoy music, but with headphones, because we're obviously keeping the sound sort of trapped into the ears. And if the sound levels are so high that a parent can hear the lyrics and the music with the headphones on, then usually that's above a recommended safe listening level. So those, I think, are the two most vulnerable population groups. And then noise even from traffic that sometimes affects our more vulnerable socioeconomic demographics. So if you're in a high traffic area, sometimes you can be exposed to noisy car environments, not just the secondhand exhaust. And then also when you go to an arena or a sporting event arena, you have to be careful about where you're positioned, because sometimes those noise levels can be too loud, can be too great on a kid's ears for too long.
Yeah. Brian, I have so many questions about a bunch of the things you just said. So let's just take it one by one. The first thing, I'm going to totally keep it real with you. I have 2 white noise machines for my toddler. I've used them I've used them since he was born, since very early in his life, to be totally honest. And if you were to tell me or to ask me how many decibels am I exposing him to, I have no idea, Brian. And to be honest, I have a pretty good one. I have what I consider a pretty controllable one, in the sense that I can pair it with my phone. It's like a fancy white noise machine, right? Is what I'm getting at. So for people like me who need to use this because I live in New York City, there's very unpredictable noise in the city, and I don't want anything to wake my baby up after I've worked so hard to put him down. How do I use it safely, Brian?
Absolutely. Well, conversational speech is around 60 to 65 decibels. We start to worry a lot about noise-related hearing problems when we go above 85 decibels. So hopefully with your state-of-the-art white noise sound machine, then we're keeping it well below that 75 range, closer to the 65, 55, 45. I would start it on the lowest possible setting and making sure that you have it as far away from your infant's crib as possible. And the reality is that you don't have to necessarily keep it on all hours of the night. It's good for there to actually be quiescence, and quiet is actually somewhat helpful, because you can imagine if you're having this sort of constant acoustic signal that's going in, then your hair cells themselves don't get a rest, right? And when we're in the natural physiologic state of sleep, we need everything to kind of have a reset. Because when you're awake, you want to be listening to all of those different signals that are around you, from the mom's voice to, for instance, the dog barking or the cat meowing or hearing the birds chirping in the environment. And so if we keep the noise levels and the sound levels to a minimum that would allow us to be lulled to sleep, but then remove that signal afterwards, I think that's your best possible strategy.
Yeah, and I keep telling myself that I'm going to do that. And then honestly, Brian, everyone passes out at home and I keep forgetting to turn this thing off. But it is absolutely on my nightly to-do list, and I'm going to be better about it. And I definitely have it far away from his crib and what I perceive as not being too loud, which leads me to my next question. I'll tell you, I was raised by Latino parents. I'm Latina, in case you can't tell from my name. But my parents didn't really slow down. It was a different time in the world. So we came to the parties, Brian. I remember my sister and I would put 2 chairs together and go to sleep, and they carried on with their, social life. And now I live in New York, as I've said about 5 times in this podcast. All of this to tell you my tolerance for noise is very high, right? Like I can have an ambulance going by and I'm not fazed by any of this. How do people like me know how much noise is too much noise? People that are not necessarily startled by noise. We've grown up with noise. How do we know, and how do we minimize it for our kids?
Totally. Well, you bring up some really interesting points, I think. By no means should you stop doing fun dances and going to parties, just having a good time. But the important thing is we can use technology, like on our phones, for instance, our smart devices, to make sure that the noise level doesn't exceed the 110 decibel level. That can be sort of dangerous usually within minutes.
Is there apps that can tell you this, Brian?
There are. You can get an app, you can program a smartwatch to sort of download it and alert you when it gets too loud. And then what you can do is you can take either listening breaks where you leave the venue a little bit. You can strategically place yourself in the venue so that you're not necessarily near the noise stimulus at all times. And, it's important for us to realize that adolescents, so teenagers, if you test their hearing, about 14% of them start to show that noise notch. And you carry that into adulthood, and that wear and tear, that auditory wear and tear that causes some high frequency hearing loss that we worry about, that makes it hard for you to sometimes hear conversational speech when we get older because the consonants are there. That goes up to around 23, 24% in the adult population. So you really want to make sure you've got your listening ears and your ability to enjoy music your whole life. So I think it's about being smart and about taking breaks. And then if you have a young infant that you bring to the dance and they're falling asleep, you can even get protective headphones or earplugs that they could wear that can sometimes either be noise canceling headphones or like you probably remember Michael Phelps or Drew Brees when they
Yes.
went to bring their kids, they wear those special earmuffs, they're protectors.
Yeah, I love all of this, Brian. Can I just ask you, what do you mean by adolescents starting to show that noise nudge? What do you mean by that?
Yeah, so there's been some good studies that have basically looked at kids using their MP3 players, and they show that a lot of times they'll use the device at a maximum volume setting, and that will unfortunately cause a temporary, sometimes a permanent shift in their hearing thresholds at a noise notch at around 2,000 to 4,000 hertz that essentially is from excessive noise exposure. And they've seen that in around 16 to 20% of adolescents. So adolescents are sort of risk takers. They like to sort of crank up the volume a little bit. They like to feel the music, but the reality is they have to do it within moderation, like all things, because they can cause some lasting damage, unfortunately.
Yeah. So what you mean is that when they test them, they have to crank up the volume of the test for adolescents to even be able to hear it. Is that right? Am I understanding you correctly?
Well, adolescents, unfortunately, have signs of wear and tear. So when they do the hearing test to see what your thresholds are, they do the softest possible stimulus and see if you get a response. And adolescents at some of those frequencies, you're right, they have to do a louder decibel level in order to meet that threshold for them to be able to hear the sounds. And that's not a good thing. You want to hear soft sounds and you want to hear the subtleties and complexities of all of music. And so it becomes that little cycle, like you mentioned, where if you have to turn it up louder to hear it better, then you're causing more and more damage in your hearing system.
It is fascinating and frightening that this is happening so early in life and that the devices that we have created for convenience in life have now created these unfortunate side effects in our teens and ourselves, right? I'm sure a lot of us adults are probably listening at a little bit of a higher volume than we should. Brian, I want to ask you about two other common scenarios. The first one, because this episode is airing on the 4th of July, is fireworks. I, to be honest, always sort of think it's a one-time event. Do we really need to protect kids' hearing? Please tell me what I should be doing, Brian, because I don't think I've taken this seriously enough.
I think fireworks should be enjoyed, but they need to be enjoyed responsibly. First and foremost, you have to be very careful to make sure that kids are at a safe distance because these things can become projectiles and they can sometimes misfire. And if you're in the line of fire, there have been injuries to the face and the head and the neck area where people have lost appendages or their vision. But that being said, it's the 4th of July. We got to enjoy ourselves. So the key thing is to be at a safe distance, but you do need to exercise caution wherever you are to make sure that those kids don't have acoustic trauma. Because if a firework, an M80 or a cherry bomb explodes near your ear, it can cause a rupture of the tympanic membrane. And we see that every 4th of July. A child is unfortunately near a bottle rocket that explodes and it lands near their ear, and it actually not just causes nerve damage, hearing loss, but ruptures the tympanic membrane, resulting in blood coming out of that child's ear. And sometimes a need for surgery to repair it called tympanoplasty.
Brian, this is the reason why we brought you on, because you are an ear, nose, and throat doctor and surgeon. You've seen what can happen, and sometimes we need to hear about those things. But what I'm getting is that if we are at a safe enough distance, the risk of these things happening is very low. Is that correct?
I think that's very well stated. Correct. I'd hate to be an alarmist. I myself am going to Taylor Swift concerts. Everything you have to think about first and foremost is safety, making sure that children are far enough away, making sure that you're doing everything in a very small dose of moderation. Absolutely.
Yeah, I love that. Now, the other common scenario that I want to ask you about is airplanes. Because again, more of us, thankfully, have the ability to fly these days. What should we be doing, if anything, to protect our hearing when we fly, and specifically our kids' hearing?
Absolutely. I've noticed as well that when you're in the back of the aircraft, sometimes closest to the jet engines, you can have that very loud noise level, sometimes 65, 75 decibels. It makes it hard for you to have conversational speech with the passengers next to you. A lot of people will obviously bring their personal listening devices on, so they're sort of tuning out that bad background noise. And some of these smart headphones actually have noise cancellation strategies. So they emit a frequency that kind of negates the jet engine frequency that can cause damage to the hair cells. So you can buy a fancy pair of headphones, or you can even just have regular headphones that cover the ears over. And sometimes that creates an acoustic seal that mitigates some of that extra noise as well. And that will help de-stress you too. You know, part of flying that's sort of stressful is that background noise that makes it hard for you to sort of relax and sleep and get in sort of a mindset. So some people find it relaxing to bring the noise canceling headphones. They feel more refreshed when they finally arrive at their destination.
Yeah. Now, Brian, would a pair of just earplugs do it?
Earplugs can work as well, too. They have to fit nicely into the ear canal. And I do want to mention that on young toddlers, it's important to make sure that plugs don't accidentally get ingested as a foreign body.
Right,
but yes,
right.
A nice form-fitting earplug can work just as well.
Or go up the nose, right?
Correct. They sell those on the internet, and those can do wonders as well.
I love that. So finally, Brian, we like to close our episodes with what we call a parenting prescription. When it comes to noise and minimizing its harmful effects on our kids, what's one thing you want all our listeners to know?
I think that we are kind of in a new age of awareness about noise, and I want parents to think about noise a lot like the way we think about protecting our skin when we're out in the sun, which is to say that everybody should get a healthy dose of vitamin D from sun, but you want to put on sunblock because you want to protect your skin from the melanoma down the road, just like you want to protect your ears for the next 40, 50, 60 years of life. So parents should be aware when they walk into any sort of venue of just how loud it is. And it's a question then of cumulative exposure, so the duration of it, the loudness of it. And if you pay attention to it, the situational awareness arises, then you can mitigate the unnecessary noise. Do you know what I mean? The unnecessary noise. You can still enjoy the music. You can still enjoy the great dancing. You can still safely use the white noise machine, but you want to do it at a safe and healthy level.
Yeah, I love that. And this conversation, like many other conversations we've had on the podcast, really goes to show that there's so much that we're learning about our kids and their health and how to be really just proactive about preventing the things that we can prevent. So I have so enjoyed this conversation, and there's so many things that I'm going to apply to my life at home with my little one. So thank you so much, Dr. Brian Reilly, for joining us today.
Thank you, Edith. I really enjoyed this conversation. It's great.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Ann Johnsos,
Doug Nagel,
Susan Stevens-Martin,
Laura Alessio,
Jackie Ortega,
Mary Claire Walsh,
Hannah Weston,
Kathy Jewell,
Catherine Beard,
and Garrett Brown.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.